All right. So excited to be here. Love the Med Bio Group. We first came to the summit last year in Arizona, and it was such a great, engaged audience. So we're thrilled to be here. And I'm excited that I'm actually able to be here in person for a virtual summit. Luckily, it was in San Francisco. So it was a quick Waymo ride for me over here. And really great to be here. Anyway, I'm Jonathan Kaplan. I'm a board certified plastic surgeon based here in San Francisco. I'm also the founder, CEO of Dr. Well. The kind of a quick overview of what Dr. Well does is that if you think of Roe or Hims and those direct to consumer websites that patients can get access to medications very easily, and that's great that they've been able to increase accessibility for patients. The only problem is that when the patient signs up for a medication, their relationship is with a website. So there's no continuity of care. What we've taken at Dr. Well is all of that tech that makes it easy for consumers to get access to medications, whether it's through asynchronous consultations, what we call smart consults, or whether it is the mobile-friendly device that Roe and Hims makes it so easy for the consumer to enroll. We take all of that technology and we put it in the hands of actual medical practices, providers, doctors, NPs. We actually have medical directors that work within Dr. Well that help nurses, NPs, and PAs depending on the state they're in and what they need. But we make that easy for them so that they can then compete on a level playing field with the Roes and the Hims of the world, the direct to consumer, the DTC sites. But with Dr. Well, we refer to ourselves as PTC, provider to consumer. So it's making it easy for the consumer to get access. The provider doesn't have to build out all the technology, whether it's going through a high-risk payment processor, mobile-friendly enrollment process, automated billing. They don't have to build that out. And of course, the big benefit to the patient is that they have an actual continuity of care. They have a practice that they can follow up with. If they have a problem, they can just call the provider. So that's what Dr. Well does. We make it easy for you to build and maintain and scale that type of platform. So today, that segues into how we help you build a structured weight and wellness program with predictable recurring revenue. Because right now, what you're experiencing is death by 1,000 paper cuts. And what I mean by that is that, your program may feel like it's going fine, but if you're doing a lot of it manually, then there is a silent killer to your program's margin. It's not necessarily one big mistake, like all of a sudden you lost your pharmacy, but it's dozens of small leaks, payment, revenue leakage, payments fail, the refills drop off, you have the difficulty getting that payment recovered. Your staff disappears, you have turnover, the staff time disappears, and you have turnover. And if you're really relying on that one coordinator to run everything and then they leave, it's really a struggle. And the thing is, if you don't see those leaks, you don't recognize those leaks, then it's very hard to fix the problem, hard to fix the business. Because the pain points now are so different than when all of this started. When this GLP-1 boom started, and now we're going to enter into a peptide boom, more so than what we already have. But the idea is that when we all started this, maybe those pain points, maybe the revenue leakage, you were able to surpass that. But that's not the case anymore. Things have really gotten more complex. But when this all started, think about your pain points back then. Think about the good old days 3 years ago. That, one of the biggest pain points was finding a pharmacy that offered the semaglutide base and not the semaglutide salt. Do y'all remember that? That was like a thing for a while, and it ended up really not being an issue. But as the manufacturers got up to capacity, then finding the semaglutide base was not a problem at all. But then you were also always on the hunt for the lowest cost per milligram, which I'm not saying that's a bad thing, but that was one of your primary focuses, was always how do I get the least expensive vial, the lowest cost per milligram, because the different pharmacies had different concentrations. It was hard to compare apples to apples. So you still want the best cost of goods, but you don't want that at the detriment of everything else in your practice. And then you also, in the past few years, were having a lot of problems finding peptides that were not research grade. Big red flag if the peptides you were getting all came in a powdered form and the patient had to mix it. So that was a problem. That was a pain point you had in the past. And then, of course, the manual payments that you were always having to, keep a card on file for the patient, manually charge them each month. And if the card failed, you had to track them down. And, that was, even if you only had 5 patients, manually charging 5 patients a month wasn't a big deal. But if even one of those patients' credit card failed, that was a huge pain. Other pain points was the pharmacy portal. And the refills, like, the patient would place an order, you'd have to go into that pharmacy portal. You've already entered their data into your EMR. Now you've got to find a pharmacy, get your credentials for the portal, log in, and then you have to manually enter the patient's information again. And then you have to find the medication that you want. You have to type in the SIG, and then maybe the name was remembered for the subsequent refills, but you still had to go in and manually refill all those patients. So those are the pain points you had in the past. And then, of course, with GLP-1s and maybe even testosterone, you've got to manually track their progression on spreadsheets. And then if it's manual, you're going to make mistakes. That's going to lead to patient dissatisfaction. And one of the biggest pain points that always took a back seat that people didn't even really think about because they didn't know enough to realize it, but it was compliance issues, high-risk payment processors, the card not present, violating Visa and MasterCard's terms and conditions. So these are all the pain points back in the day. And you may have been able to muddle through because there wasn't as much competition. There's a lot of patients, but it was also very heavy staffed, heavily dependent on your staff. And over time, that creates operational strain, inconsistent patient experiences, missed revenue opportunities. So the thing is, present day, if you want to remain relevant and not watch your program just whittle away over the course of 6 months due to death by 1,000 paper cuts, you need structure in your program now. It's critically important. Again, you might have been able to get away without it in the past, but you can't anymore. Without structure, you've got revenue leak. And let's talk about some examples of that revenue leak. So if you're just like trying to get the lowest cost of goods and you've got your pharmacy portal, the problem is the pharmacy portal is not revenue infrastructure. It's good for the pharmacy. It doesn't really do anything for you. Because the problem is that even if you can order that medication through that pharmacy portal, you still have leakage because your pharmacy portal is not going to help you with recovering failed payments. It's not going to help you with refill drop off. You don't really see the true margin as far as staff cost and things like that. And then you're going to have the staff is going to be overwhelmed with all these operational things that's going to take up a lot of their time. And all of those things, the cost that you're putting towards staff time for wasted time and that's inefficient, that's all leading to revenue leakage. So yes, you have your lower cost of goods here, but all of the other expenses you have are nullifying that revenue. And so you've really got to protect your revenue also when the staff turns over because you can't just rely on one person. And this is what I'm getting at is that let's say you find that, and by the way, I want to clarify, while I'm talking about focusing on the lowest cost of goods is not enough, I'm not saying getting lowest cost of goods is not important. I'm certainly not saying that we can't help you get the lowest cost. Our network with our group purchasing power, we certainly can absolutely get you the lowest cost of goods. I'm just saying that focusing only on the lowest cost of goods is really bad. Look at this bar graph. Obviously, it's qualitative, not quantitative, but you might save $20 on a vial. That's great. But the problem is, if you don't have structure, you've got revenue leakage, you've got refill drop off, you've got failed payments, and so you're just the cost of the cost of the money you're losing is certainly overwhelming the money you may have saved for that vial because you've got the card failures, you've got the refill drop off, the manual billing errors, you've got no payment recovery other than your staff trying to act like a bounty hunter trying to track down those payments from those patients' failed payments. No margin visibility. Your staff is wasting a lot of time chasing those payments. And so it could be 5 to 10 hours of staff time per week. You do the math, that's $8,000 to $25,000 in additional staff time that's wasted on all this inefficiency. So while it's important to find the lowest cost of goods, which we can help you with, it's really important that you don't only focus on that because you're going to be losing money in so many other ways. You've got to really start protecting your margin. So the other thing, big issue with your revenue, your margin, your program is if you're putting all of your faith in one person. He or she may be a great person. They also may be embezzling from you. You have no idea. But the point is you can't rely on one person in your practice. That's why medical practices in general are not very scalable when you just have one doctor in the practice. But in the practices that have one person managing everything, they're managing the recurring billing. If they're doing that manually, they're going to maybe miss a manual charge. The declined card, when the card gets declined, that one person has to follow up. That's a lot of wasted time. They've got to figure out the refill tracking, of course, what dosage they're on, the dosage progression. And then the pharmacy coordination, they've got to find all these different pharmacy portals because you all know that not one pharmacy offers everything. Strive is an amazing pharmacy. They do offer so much GLP-1s, it's topical skincare, pharmaceutical grade skincare, but they also don't offer pellets. I think they're okay with that. I don't think that's anything bad that I'm saying about them. Strive is an amazing pharmacy, but there are some things they don't have. And more importantly, there are pharmacies that don't always have a license in your state. Strive does have a license in most states, but not all states. And then in some states, where they do have a license, they may not be able to ship GLP-1s. Again, this is not shade on Strive. I'm just saying that you can't rely on one pharmacy for everything. And I think the pharmacies would recognize that, although Strive can definitely cover most of it. But that's the thing, is you're going to have, if you're doing this manual, you're going to have multiple pharmacy portals for certain states, certain medications. It's pretty overwhelming for one person to do. And then, of course, the rates change, and like, are your prices keeping up with the rate changes of your cost of goods? Patient communication is going to fall through the cracks. The margin tracking, these are all really major problems if you have everything relying on one provider. You haven't automated your program. You don't have structure to your program where if your coordinator leaves, other people can step in, so that you can minimize payments failing, refills lapsing, revenue stalling, institutional knowledge disappears if that one person leaves. So it's really critically important. If your medication revenue depends on one employee, you do not have infrastructure, you've got fragility. So where do practices mostly leak revenue? And I'm just going to go over these 5 right now, and then we're going to go through each one individually. But first off, a lot of programs just have visit-based billing. Like when the person comes in, we charge them. Well, the problem is when they come in. What if they don't come in? What if you're relying on your existing patient database and that person doesn't keep coming in? So you've got to really also focus on filling your funnel in addition to your existing patients. You might have limited products or limited pricing options. Patients want to be able to pay once a month or once every 3 months, and you've got to be able to figure that out. There's some complexities to that. Then there's no defined retention cadence in a lot of these practices, meaning that they don't have that automated subscription billing, much less whether they come in once a month or not. But you need to be able to bill these patients automatically every month, whether they're coming in or not, and then have a way of automatically getting their credit card updated. That's what the term dunning is. The credit card fails, and then you get that information updated. That whole process is called dunning. Then there's also the manual tracking. That's another big source of revenue leakage, is that patients are not being upgraded, or you've got to manually keep track of that. You miss an upgrade, or maybe they don't need to be upgraded each month. You need to have that way of automatically upgrading them or locking them in at a particular dose. And spreadsheets, manual follow-ups, that's not going to help you get your goal of a consistent revenue. And then, as I mentioned before, the pharmacy portal dependency. Pharmacy portal is great for the pharmacy. It's not going to help you with managing your subscriptions. And of course, just the double data entry of having to enter the patient's information every time. So I feel like at this point, I've adequately identified the problems that you have if you don't have a structured program. So let's talk about solutions. And your EMR is not a solution. Your EMR is great for, I don't know. EMRs, everybody hates their EMR, so I'm not really sure what I can say about it. But yes, there's patient documentation. That's important, but there's a lot of other ways to document patient interactions that you don't have to have an EMR. EMRs maybe are great for insurance billing, but insurance billing inherently is just an awful experience. And that's why you're all here today, is you're tired of the insurance game. If you look over the last several decades, people keep fighting, but reimbursements keep going down. They're not ever going to come back up. So your EMR is not the solution to all this. Let's start with the basic billing, waiting on the patient to come in. You really need to be filling your patient funnel. And yes, you're going to be spending tons and tons of money on marketing, but really one of the best ways to fill your funnel, so you can really not just rely on your existing patients, is make it easy for new patients to get into your funnel. So let me explain what I mean by that. This is one of our providers who, great looking website. You don't even have to have a nice website like this. You just have to have a website, but it could also be on your link tree, on your social media. It could be out in eBlast. But what you need to have on your website or link tree on your eBlast is a way for the patient to get into your funnel. And one of those ways is a smart consult. This provider calls it a smart consultation. We call it a smart consult. What I'm talking about are asynchronous consultations. That's when patients are able to fill out a questionnaire online, which they can fill out a questionnaire online in all 50 states and DC. But there are 19 states where after they fill out that form, you do have to have a formal virtual visit or in-person visit with them before you send them medications. But in 31 states, filling out that form is all you need for you to review their questionnaire and then be able to legally send them medications. So this is an easy way to get people into your funnel. So I'm going to show you examples of how an asynchronous consultation works. So the patient clicks on Smart Consultation and it brings them to a page like this with their logo at the top. And it goes through and asks them a series of questions. But first off, it asks them, what do you want to talk about? Do you want to provide information and follow up and start a journey on weight loss or testosterone therapy or menopause, longevity, addiction, compulsive behavior? And the patient chooses one of those or multiple ones, and then it takes them down the path of that ask that line of questioning. So that's where the smart consult is smart, is they choose that particular area of interest, and then it asks them questions specific to that. So they're not just asked everything about everything in the hopes that you hit the nail on the head. So you go through and that patient answers all of these questions, and this is something that we host for our providers. And then I want to show you that after the patient answers those questions, then you are able to review all of their answers in the back end. And I want to take you through a video here, and this is really important. Focus on this. You'll see where I'm going with this. But anyway, you see in the back end, you see the patient, I've blurred it all out, and you can see the patient's demographics. You can see the patient's answers. And let's go through the answers here for this patient. So they found us through social media, and they mentioned that they have previously taken tirzepatide and that they are looking into compounded meds because the brand name is so expensive. And then they also mentioned that specifically they're currently on the name brand of 5 milligrams, and that's why they're looking for compounded meds, but they're currently on 5 milligrams. So do they want to go up to 7.5 milligrams? Let's see. And then they express interest in a particular medication, GLP-1 squared, which I'll talk about later. They check all the boxes to show that they've consented to, providing this information and the provider reviewing it. So that's how the provider reviews that. But how do you then respond to the patient? This is really cool. This is amazing. And everybody's got AI now. This is something that we've incorporated, is that when you reply to the patient, you can, recommend a particular medication treatment package for them. This is if you have structure. You can't do this without structure. So you can recommend a particular medication. They said they're interested in tirzepatide. All right, tirzepatide, no problem. And then with AI, we can provide a prompt. You don't even have to prompt it, but you can add additional prompts, about that the enrollment link is going to be available for that 5 milligram dose, but let us know if you need to go up to 7.5 milligrams. We don't know if they're wanting to stay at maintenance or go up. And then we'd let them know that their meds can be sent out the following Monday if this was on a weekend. And so look at after you click on Generate AI, look at the answer that AI provides. It first says that, hey, it's great to see that you're already responding to 5 milligrams, but you're looking to improve upon your weight loss. And then it goes into the fact that, okay, we know that you said that the name brand was too expensive and you're looking to be more cost conscious. This is all AI producing this. And then it says, then it even includes the part about, well, are you looking to increase to 7.5 or do you want to stay at 5? Just let us know so we can make sure we cater the treatment plan to you. And then it includes the information about we can ship out the medication on Monday and arrange for virtual training, injection training afterwards. And then what you do at that point, you review that, you agree to it. I'll show you in a second where you have to agree to it, that you reviewed the AI. And then as the provider, you click send, the patient gets a text, they click on that text, and it opens up a mobile-friendly consumer portal where they see the medication you're recommending, where they can click enroll now. They're then automatic that they click enroll now. They've already created their consumer portal. They enter their credit card information. It's processed through a high-risk payment processor, and you're making revenue after hours, on the weekends, 24/7. So this is the kind of structure that you need to be able to compete with the Rose and the Hims of the world. Now, you may say, oh, I'm a high-touch practice. I'm not like these telehealth companies. I agree. That's fine. If you're special, you're special. That's great. But I'm not saying that you have to be low touch and just trying to have volumes and volumes of patients like the telehealth companies. I'm saying that you are competing for the same patients in the sense that if patients are coming to you, they like your high touch system, but they have to come in every month to get their medications, or they have to call in with their credit card every month, or they have to come in and pay with their credit card, or their credit card fails, or when it's time to sign up, that they have to go through this whole arduous process, or that you're sending them the wrong medications or the wrong dosage because none of that's automated, they're going to eventually gravitate to a low friction entity. And that may be the direct to consumer website, or it may be me because I'm providing a nice, structured, easy to use platform for them to sign up for my weight and wellness program. So that's why it's really important to understand that this kind of a process, this is not meant for you to become a DTC program. It's just meant for you to be able to compete and make it easy for your patients to enroll in their medication program the way the DTC programs do. So I want to go through several other examples of what the AI can do after they review because AI is not only you following my prompts, but the AI is following their answers to their questions. So let me just show you a few more examples. I recommend tirzepatide, give them a couple of prompts. Oh, this patient mentioned that they had pancreatitis in the past. So I want to mention, well, hey, pancreatitis is okay as long as it wasn't due to GLP-1s. And so that's the prompt I gave. And the AI learns every time. So it may have said this on its own, but I wanted to make sure. So the AI says you shared a history of pancreatitis, that the medications do have a low risk of pancreatitis. And as long as your prior episode wasn't due to GLP-1s, it's okay to use this. But we definitely need to start at a low dose and closely monitor you for any symptoms. This is AI coming up with this response. This is so much better than a response I could come up with or my office staff. And then the other things is something I didn't even include in my prompt, but something I did notice when I reviewed the answers is this person said that they had a history of binge eating problems, and AI is recommending them, yes, tirzepatide can help, but you need to pair that with behavioral support. How brilliant is that? That's certainly great advice that AI is coming up with that yes, you may see the binge eating in there and you may say, oh, well, like, we can give you tirzepatide, but AI is responsible enough in this case to say you also need to pair it with behavioral support. So really incredible. Another example, I recommend semaglutide, and I give them a prompt. But one of the things that's really cool here is that the AI recognized that in their answers, aside from them saying they wanted tirzepatide, that they were also interested in skin and hair support. AI recognized that in their answers and is offering them other options to layer on top of their weight program. So here, AI is recommending upselling the patient on other things that they expressed interest in. So really incredible, better than maybe what your front office staff could do. Another example here. This is a patient. This is the AI recognizing that in their response, the patient mentioned that they had high blood pressure and irregular heart rhythm, and the AI recognized that, okay, that's important for us to take into account. I'm not saying that this replaces your assessment of the patient. It just helps you with your response to the patient. Like you should be noticing the patient said that in their smart consult responses, but AI just helps you formulate and articulate the follow-up for that patient. Another thing I want to highlight here is that in those 19 states I mentioned that you do have to have a follow-up visit. Our system recognizes that if they're in one of those states, it also recognizes if we're all asking about testosterone, you have to have a virtual visit for that. So our system recognizes that they're in one of those states that needs a follow-up. And in the response, I give them, I had to do some prompts and things like that. They were interested in GLP-1 squared specifically, which I'll talk later today. The AI explains what GLP-1 squared is. How it's a combination of semaglutide and tirzepatide, how it works on multiple pathways. And then it also talks about the different other things about the prompts as far as, the injection training, sending out the medications. And then the AI automatically includes the message about, hey, we also have to have a follow-up or virtual visit with you or an in-person visit with you before we send out your medication. So AI takes care of all of that. And then the thing that common to all of these AI responses for all these different patients I'm showing you, that you then have to review this and say that, yes, I'm a provider. I did review the AI response and I am agreeing that it was all appropriate. So really exciting how you can use AI just to respond to these patients in much more articulate, complete ways than what you could do on your own. Next thing I want to talk about, another part of revenue leakage, is having really restrictive provider pricing, because you need to give the patient more options. They want more options. Maybe they don't want just one medication. Maybe they want a bundle of multiple medications. So for example, you can offer tirzepatide, Hair Force One, which is a hair supplement from Strive, and then there's BPC 157, which eventually will be from Strive. But that's the thing is BPC 157 peptide that was on Category 2 list. It's still on it, but they're looking to move it off. Looks like right now there's no enforcement, so that's why more and more 503A pharmacies are offering BPC 157, and it is definitely not coming from a research grade entity. We don't do any of that. So anyway, if you are, worried about all the competition and you don't feel like you can just charge $600 for tirzepatide anymore, well, you can start to still charge $600, but now you're giving patients more value. You're giving them the tirzepatide, the Hair Force One, the BPC 157 all bundled together. That only works if you've got the lowest cost of goods. Because if it's like taking up your whole $600, that's not very good. But because of low cost of goods, which you can get in a network, you can get better than maybe even a GP can get you. You still have a great margin here, 55%. So those are some examples of non-restrictive provider pricing that you can offer the patients bundles. You can also offer them monthly or quarterly or any variation of payments. But this gets more complex because, well, I'll just show you. If option one, this is a case from our updated platform where it's tirzepatide and Stella. Stella is a pharmaceutical grade skincare product, also from Strive that our patients love. But if you want to do pricing on different packages, then you would have option one where it's where they're paying every month, or option two where they're paying once every 3 months. This gets complicated. So let's look at option one. You can see here this timeline that you have to have. And this is very hard for you to do manually. You have to have this in an automated way where you can see here the dollar signs show the payment. Hopefully you can see my cursor that you're seeing these payments every month. Then tirzepatide and Stella and NAD that you can add that as an add-on. Those all of the once the patient signs up, all three of those prescriptions are auto-generated in the system, and then you go in, you submit those. Great. But then as the timeline goes on, 28 days later, you have another prescription for the tirzepatide, but 2 days later, every 30 days, and you have the Stella and the NAD. So you've got to make sure that even though you're charging them on the same cadence every month, that the prescriptions are coming up for renewal at different times. And so that's why you have to have a system structure to make sure that you can figure that out. The other thing is, if they want a refund after you've sent out a couple months, they might want a refund. But you've sent out one medication, but not the other two. You've got to make sure you're refunding the appropriate amount because you're not refunding for the medication they already gave them. So this is the kind of complexity that you have to have now to compete with a bundle, but that requires some structure. So in this option two, let's say you're going to allow them to pay every 3 months. So then you see in this timeline, you see the payment there, all the medications, prescriptions are generated, but then you have to have these medications, prescriptions generated in the intervening time before they're charged in that 3 months later. Now, the idea here is they're charged here and they're paying for all of these meds right here in that first payment, and then they're charged here, and then they're going to pay for all of these meds in the second tranche. So this is complex, more so if they ask for a refund that during that 3 months, well, you've got to look, okay, well, I'm only refunding you for what you haven't utilized yet. And then you also got to make sure that those prescriptions aren't submitted. So this is the kind of complexity that you need to be able to offer your patients, but you can't do it on your own. You can't do it manually. So next, I want to talk about a defined retention cadence. That's the automated charges each month. And I want to talk about how we should have no concept of refills. We don't in our platform, because the idea is that providers will give a patient a refill, medication subscription for 6 months, whatever the medication is for 6 months. And that's really generous. But the thing is, remember that maybe you saw them in your office and you charged them for that office visit, and then you gave them 6 months of prescriptions. Unless you built it into your initial visit, you're essentially giving that patient 6 months of free support, because they may have something they have a question about during those 6 months in regards to those medications, but you're not charging for that. You have no way of charging for that unless you were smart enough to charge at the beginning. But it's kind of crazy how we give patients 6 months of medication refills and we're providing support for them for 6 months. We're on the hook. We're their provider. We're there for supporting them if they have any side effects to any of the medications, whatever the medication is, but we're not really getting reimbursed for any of that. So we have no concept of refills. It's just the patient gets their medication, they're charged, they get their medication, and then they're automatically charged again 28 days later, 21 days later, whatever you choose, your cadence. And then they're charged again, and then that auto generates another prescription. And that's what I'm showing you here on the left here is all of these auto generated prescriptions for patients based on each charge. They don't get charged and then you have to go write a prescription. They're charged for the package they signed up for. You know what medication they wanted, and then they get charged, and that auto generates a prescription. You go in, you review that, and you submit it. It goes to the appropriate compounding pharmacy. And if their credit card fails, that's the dunning. You have to have this defined retention cadence. If their credit card fails, you need an automated way of letting the patient know that it failed so they can update their credit card if they want to get their medication. Then it comes to the manual tracking, the spreadsheets that we all have seen before, where you're tracking what dose they're on during that dosage progression, whether it's testosterone or GLP-1s. And we have all of this. You want like AI protocols, things like that. We've got those protocols already where it shows whether, depending on the medication, on the left, you see how it goes from 2.5 to 5 to all the way up as far as the different medications. So you have that tracking done. And every time the patient's charged, it automatically increases them to that next dose. So you're not having to manually track it. And if you want to lock them in on a particular dose, no problem. You lock them in on that dose. But what's even cooler is now in our new system, we are actually able to provide the patient with all of that information ahead of time. So they get an email, they can see tirzepatide glycine, and they see all the different doses that are coming down the pipeline for them. They see the amount of units they're going to need to do. They see all this. So they're all educated about this. They see that cadence coming down coming down the pike for them to see what medications they have. So it's really cool to not only have all of these treatment protocols already generated for you, but to also to be able to share that with the patient in a really nice mobile friendly way so they know exactly what they're going to be dealing with. And maybe they'll see, oh, I see that in my next dose is 7.5. I clearly don't need that. So I'm going to let my provider know I'm going to stay at 5 milligrams. So it's very, very cool for the patient to be able to have that insight. Fewer questions, hopefully, but better patient satisfaction, hopefully. So continuing on to our next example of a problem of leading to revenue leakage is the pharmacy portal. Again, it helps the pharmacy, but not your practice. The thing is, having multiple pharmacy portals, you have to figure out which pharmacy you're sending the medication to, what pharmacy can send to that particular state if you have multiple state licenses. So you need to have access to all of these medications without having to go to multiple pharmacy portals. So for example, our formulary that we have at Dr. Well is, you can see all this is in our catalog online, but it shows all of our hormone therapy. You can see all of our rates for hormone therapy, creams, injections, hormone therapy for women. We can also show you all the different metabolic issues, like if you're looking for thyroid medication, we have access to that. Peptides, BPC 157, GLOW, GHKCU, methylene blue, NAD, and all its different forms. Sexual health, not just ED, but things that keep people interested in having sex. And then also all the pharmaceutical grade skincare, which Strive is incredible for this. And then for general wellness, all the needs you have for your IV therapy and for your GLP-1s, all the different types of formulations you may need depending on your state, and then all of the pricing for that. And we have great pricing. And I know that was fast and you weren't meant to be able to take notes on all of it. But my point is, you have to have access to all of these medications, which necessitates you having access to multiple pharmacy portals. And you just can't really expect to be able to do that on your own. And then, so let's take a quick look at just some example numbers. So you've got 40 patients, you charge them $3.99 a month, which is reasonable. Average retention is 5 months. You're going to have 10% failed payment rate. We're not saying you won't, but the admin hours, 8 hours, staff cost, $25 an hour total. And in your current state without structure, you think you're making a lot of money, $191,000 of gross revenue, but you got $19,000 lost from failed payments, missed retention, lifetime value, that admin overhead costs because they're not being efficient. So it's additional hours that we're taking into account here over the course of a year because they're not able to be efficient. And so next thing you know, your net revenue is $145. But with structure, with automation, with structure, you can help increase your payment recovery, retention lift, the admin time saved, your cost of goods savings because you're part of a network that's getting you the lowest cost of goods. And so next thing you know, you're actually gaining money with this additional structure. And this is just one example. And we haven't even talked about compliance yet. The thing is that when it comes to the pharmacy portal risk, you've got to have all these different pharmacies. As I mentioned, you need to have access to one portal, all meds, all states. That's what you need to compete in this day and age. Yes, you can have multiple portals to do it, but you're going to have trouble keeping track of it. So you need, let me say it again, you need one portal, all meds, all states. That's what you need to minimize your frustration with all of these different pharmacy portals. The payment processor risk. So people think, oh, I'll just charge this like I charge everything else in my office. These medications, not because they're compounded, but just medications in general, these are high risk services. They need to be processed with a merchant code, credit code that is a high risk category. And so your regular EMR or Stripe or Square, those are not high-risk payment processors. So if you are processing that, you're going to violate the Visa and MasterCard terms and conditions. You're going to get shut down. You may think, oh, well, I haven't gotten shut down, but there are people around you that are getting shut down because they are processing payments through these high-risk services without a high-risk payment processor. More and more people are going to get shut down. You're going to start to hear about people getting shut down. This isn't me just fear-mongering. This is a really legitimate thing. So that's why you have to have a system in place where you're able to process these payments with high-risk payment processors when the card is not present. And if you do this on your own, the rate is going to be so much higher. That's why people don't automatically get high-risk payment processors. And a legit script, if you're trying to advertise, you can't really do it unless you get legit script certification for digital advertising, and that's expensive and it takes several years. So these are all the compliance things that you didn't necessarily even know about, but ignorance is not an excuse. You can still be liable for all of it. So if you take a look at all the different facets of an unstructured program, you've got this single coordinator that you're relying on. You've got your GPO that's probably not even providing you the best rates. You're processing payments through a high-risk payment, you're processing high-risk payments through a non-high-risk payment processor. You're trying to keep track of these 503A and 503B pharmacies. You've got GLP-1s, but you want to add peptides, you want to add hormones, you want to add hormone pellets. You're trying to shoehorn all of this into your EMR. It's not going to work. Eventually, one thing is going to fail, whether you get shut down for your high-risk payment processing for a non-high-risk payment processor, or your program coordinator leaves, or you can't keep track of your pharmacy, or your pharmacy gets shut down. So you're just not going to be able to do this all on your own. You need structure. So at this point, I'm happy to answer any questions, and you can take a picture of this QR code if you want to learn more about how we can help you. And I will see if I can pull up these questions here. Lots of questions. Wow. Okay, so I'm going to have Katya come in here and help me with these questions. Great. Yeah, I'm going to have Katya help me with these questions. But anyway, I want to thank y'all all for your attention. Please take a picture of the QR code to learn more about how we can help you structure your program. And I'll be back later talking about novel compounded GLP formulations. And it's a very exciting world we live in. And with peptides coming on board, this space is not going anywhere. So Katya is going to help me with the questions, and I'll start answering.
All right. So this first one, what AI platform is used and how is it trained?
It's Dr. Wells. We've built out this AI system within our smart consults, and we are sourcing it from large language models, from like Claude, from Anthropic, and from OpenAI. So we are sourcing the large language models from multiple AI companies, and we're just doing it through an API call for each one of the smart consults. And it's really cool. So I'm glad you asked this question. So that's how we're using it. But none of the patient information is being shared with those AI companies. What we're able to do is we're able to share all of the patient's answers, but not their name, not their date of birth, not any of that. So from a HIPAA standpoint, we're totally good. So we're sharing all of that information that they answer that's basically not protected health information, no PII or PHI. And so the AI is still able to form a really good answer based on the information they provided. And of course, we can tweak that even more so with the prompts that we have, but you don't even have to add prompts. And the thing that's really cool about what we have is that each time you prompt it, after about 4 or 5 of the same prompts, our system recognizes that you're using those same prompts, and it will automatically include that information in an ongoing basis. So our system really does learn so that you don't have to keep doing the same prompt every time. So our AI is learning how to give you better answers, and it's also doing it in a way that's HIPAA compliant. It's extraordinarily exciting. I just can't get over how articulate the AI is and how responsible it is, but you still need to watch it. I haven't seen any hallucinating yet, so it's been a lot of fun. And we're also developing a chat bot for our providers so that instead of you looking at the reports tab within the back end of our system, you can ask our provider facing chat bot, how much revenue did I do in BPC 157 last month? So things like that we have it all available in our reports tab, but obviously it'd be easier if you just type that in. So that's a provider chatbot that we'll be releasing soon. And then to follow after that, we'll have a consumer facing chatbot that if you choose, you could put it on your website that will be able to answer questions specifically in regards to your weight wellness program through Dr. Wells. So a lot of exciting things coming on with AI.
Yeah, it's incredible. I think what's coming with AI. I think it's going to be so interesting to see even where we're at, like 6 months, 12
Oh,
months.
for sure,
It's
for
like,
sure.
it's like completely game changing, like every single industry. Can you talk more about the marketing side of your platform?
So from a marketing standpoint, what you get included for free if you come on board is that we will, with your permission, we can go into your email marketing platform. We can create a template for you for an e-blast, so you can announce to everybody that you're either refashioning or starting or building your weight and wellness program. So you can, so we will help create that template for you in your e-blast for free, and then you can send that off to your patients whenever you want. We're not asking for your email database. We're just going in to create the template for you. So that's free. The other thing that's free is that if you are, depending on what tier you're on, what plan you're on, you will be on our provider finder. And then we spend a lot of money each month driving patients to, we're spending money on Google and Meta, driving patients to our provider finder, where you'll be listed for each state you're licensed in. And depending on what tier you're in, how many states you can be licensed, not how many states you can be listed on, but obviously that's dependent on how many states you're licensed in, and how many different services you offer will allow you to come up more frequently on filtered results on that provider finder. So all of that is the free marketing that we provide to you, driving people to your provider, to our provider finder, where they can see all the providers in their state that are near them. Then separately, if you want to pay extra, that because we're legit script certified, we can run legit script certified types of ads where we can mention testosterone, tirzepatide, things like that on Google and not get shut down. And so we do have a partnership that with a marketing company that if you choose to do that, again, this is totally optional and separate. I don't want anybody to come away thinking that you have to do this. But if you choose to use the legit script certified ad provider ad system, then it is a minimum spend of $1,000 a month and a $750 per month ad management fee. And if you spend $5,000 in ads, it's still $750. So at a minimum, it's $1,750 a month, 1,000 for the ad spend, $750 for the management fee, $750 per month for a minimum of 3 months. That's something you can choose to do and leverage our legit script certification. And those ads will be driven to a landing page specifically for you. It'll be on our domain because we're the ones legit script certified. You're not necessarily legit script certified, so we can't drive them to your website. But it'll be a landing page where the patient will only be able to see your information, your before and afters, your testimonials. They can fill out that information there. Boom, you've got a lead. And then if they tap one more button, then they will be brought to your specific smart console with your logo, and then they can fill out that information. And now not only do you have you gotten a lead, but now you get all their medical history too. So pretty sweet.
Yeah. And it is something that's it's like so important to make sure that you're doing that in an appropriate way, because if you are not, it gets shut down very, very quickly.
Yeah, it was fun at the beginning when it was the Wild West, but wherever there's money, there's regulation, and it's basically people doing doing bad things, and they implement regulations, which we all kind of have to suffer through. But you got to play by the rules.
And so someone asked actually to share again the slide on compliance and legit script, which I mean, you were just touching on. I guess for this one, if there's a specific question regarding compliance, if you want to put that back in the chat, and then we can ask it. And does your pharmacy ship to Idaho?
Yes, yes. Well, so it's not just one pharmacy. So keep in mind, we are just a SaaS platform, software as a service platform, and we're connected to many compounding pharmacies across the country. So we make sure that we have coverage for all 50 states and DC. And yes, we absolutely have coverage for Idaho. Not because I'm specifically sure that we have coverage for Idaho. I just know we have coverage for all states because we have so many compounding pharmacies to ship all meds. Now, maybe, if you want a specific formulation, tirzepatide with glycine and B12, maybe you can't get that in a particular state because that comes from a specific pharmacy, but you can get tirzepatide glycine, and you can get tirzepatide with B12, you can get tirzepatide with B6. So there's definitely options there. You just have to be, well, and again, that's not our restrictions. That's just state regulatory requirements and the compounding pharmacies licenses.
And so I guess this kind of answers this other question on like how you would define Dr. Wells SaaS platform
Yeah.
versus
Yeah, we're definitely not a
pharmacy,
pharmacy.
EMR account adding.
We just help you with all the tech, so that in the kind of connections to the compounding pharmacies, and which gets you lower cost of goods, so that you don't have to try and figure that all on your own, because you're never going to get the cost of goods down as low as you want. Even if you had 1,000 patients in your own practice, that doesn't compete against platforms and DTC companies that have tens of thousands, hundreds of thousands of patients. So 1,000 patients is a lot, and I'm proud of you and I'm happy for you, but that's not going to get you the best rates. That and even if your pharmacy tells you those are the best rates, they are not.
If we are already legit script certified and have a payment processor, do you have a tier with just access to the pharmacy portals?
Yeah, I mean that's our that is our tier that will give you access to all those things. Again, the legit script and the payment processor is not specific to one tier. That's what we offer. But to use our platform, every patient need to be enrolled through our platform. So we are going to be processing those payments. So if you are wanting to use your own payment processor, that's fine, but then there's no reason for you to use our platform, because it has to be run through us. But you have to understand that even if you have that high-risk payment processor, you're not going to have all that structure. You're not going to have that ease of online sign up for the patient. You're not going to have access to our cost of goods. So the only way you get access to our pharmacy portal, the only way you get access to our pharmacies is if you submit a prescription to those portals. The only way you get a prescription is if the patient signs up to generate that prescription. So the patient still needs to be funneled through our platform for our high-risk payment processor to sign them up for the package, for them to get the prescription, for you to be able to submit it to the portal.
And what is your onboarding or training platform?
So yeah, I mean, when somebody signs up, we have an onboarding specialist, and you can be ordering meds through our platform. Your patients, your staff be ordering meds through our platform within 2 days. We take care of all the onboarding with all the different pharmacies. So the holdup is never us. The holdup is always the providers getting things together and deciding what they want to charge patients for these different packages. We don't dictate how much you charge. We just show you what the cost of goods are. You decide what you want. We can give you recommendations on what to charge to make sure you cover your cost of goods and then some. But you being able to order through our platform is easily within 2 days.
And then are all the pharmacies you use 503A?
They are. And we also have access to 503B, for pellets and hormones and things like that. But yeah, all the peptides are coming through a 503A pharmacy, multiple 503A pharmacies, GLP-1s, pharmaceutical grade skincare, medications for IV therapy. Everything is from a 503A or 503B pharmacy.
All right. I just kicked off the Zoom.
Hopefully not everybody else did.
I know, fingers crossed. What happens to our patients' info when we decide to leave Dr. Well?
It's still your patient info. Yeah, hopefully you know, but yeah, it's still your patient info, but you will then very quickly get kicked off all of that preferred pricing that you're getting through the compounding pharmacies that you found through us. You'll still your patients, but then you'll be just destroy your profit margin.
Okay, give me 1 second, sorry.
Okay, you want me to?
Yeah.
Okay, so question. So okay, here's what the pricing would be. So for Dr. Well, we have 3 tiers. I'll just focus on the middle and top tiers because those are the only ones that include the provider finder access, be listed on the provider finder, and the middle and the top tier are the only 2 that include peptides along with all the other medications. So the middle tier is $6,000 per year. The top tier is $8,000 per year. What's the difference there? Since you get all access to all the medication, you get access to the smart consults, you get access to that AI within the smart consults, you get access to all everything. The big difference between the $6,000 tier and the $8,000 tier per year is the fact that you get the lowest processing fee, which is 2.9% with the high risk with the high tier for the high risk payment processing, 2.9%. If you went and did high risk payment processing on your own, it's like closer to 4.5, 4.9%. So if you're in the highest tier, $8,000, 2.9%. If you're in the middle $6,000 tier, the payment processing goes up to 3.25%. And if you're in the $8,000 tier, you get the lowest cost of goods. And if you're in the middle tier, you still get lower cost of goods than what you can get on your own, but just not the lowest available. So that's the annual price for the Dr. Well, and there's no setup fee. It's just that's the price, and you're just ongoing. The smart consults. There's no per uh, per consult or smart consult fee or anything like that. If you're looking for a medical director, that's also a service we offer, but that's a separate thing that we can talk about.
All right. Well, thank you so much.
Hey,
Let me have Alex come in here. He's going to help us.